दिल देना दिल लेना है सौदा खरा खरा. You have seen this in Good News, right? इसमें उनका spam mix हुआ था, वही sperm यार. So, talking about oral contraceptive pills, a 25-year-old woman asks about starting oral contraceptives. What's the first thing you need to assess? First thing. Let's talk about it. Hormonal control, the basics. Birth control pills contain synthetic hormones which are basically of two types. One is estrogen and second one is progesterone, also known as synthetic progesterone. They manipulate the menstrual cycle of the patient to prevent pregnancy. Mechanism. Primary mechanism, very simple. FSH LH blocked, no egg drops. है ना इतना आसान, आराम से याद हो गया गाने से. FSH LH blocked, no egg drops. Cervical mucus thick, thick stops. Endometrium thin and dry. Endometrium thin and dry. Sperm can't swim, can't fertilize. Sperm can't swim, can't fertilize. Such a simple and easy song. Then talking to estrogen action memory. Estrogen stops FSH. Estrogen stops LH. No surge, no egg, no pregnancy. Hypothalamus pituitary ovary. It basically blocks the hypothalamus pituitary ovarian axis. Just revising that, hypothalamus, then pituitary, and this here is the ovary. Hypothalamus produces gonadotropin releasing hormone GnRH, which goes to the anterior pituitary, which secretes FSH and LH, and this stimulates the ovaries. There is an LH surge which causes ovulation. LH surge, always remember this. Ovulation occurs due to LH surge. This is basically inhibited. This is the hypothalamus pituitary ovarian axis. Then progestin power chant. What does progestin do then? Progestin blocks GnRH release. Progestin blocks GnRH release. Mucus thick, sperm can't increase. Progestin blocks GnRH release. Mucus thick, sperm can't release. Sperm can't increase. Sperm can't increase. Sperm can't increase. Endometrium won't receive. Endometrium won't receive. If endometrium won't receive, contraception achieved. Yay! Desogestrel. Ovulation blocked. Norethindrone. Less effect rocked. रॉक ऑन है ये वक्त का इशारा, रॉक ऑन हर लम्हा दिखा रहा. Then emergency contraceptive. Suppose you have had sex, premarital sex before marriage, and you don't want the pregnancy. Then what you will do? Urgent medical rhythm. Levonorgestrel, LNG. Levonorgestrel delays the egg. UPA, also known as ulipristal. UPA blocks LH surge. The best part about ulipristal or UPA is works for 120 hours. That is the highest working time. That is 5 days. After having unprotected sex without using condom, you can use it, ulipristal. But in the case of levonorgestrel, it is better if you use it within 72 hours. Mechanism: ovulation delay, not abortion. Clear the way. Complete triple mechanisms for NEET PG USMLE high yield. 3 ways pills prevent conception. Number 1, block ovulation, main protection. Thick cervical mucus barrier. Thick cervical mucus barrier. Thin endometrium. Implantation carrier. Remember, hypothalamic suppression, cervical changes, endometrial regression. Hypothalamic suppression, cervical changes, endometrial regression. Side effects warning. This is extremely important. Side effects of estrogen and progesterone. Estrogen causes clots and stroke, also known as cerebrovascular accident. Progesterone brings weight and mood broke. Mood swings occur due to progesterone. Contraindications: smokers over 35. I'm not a smoker, but I am over 35. But all of you girl smokers, please stop smoking. Smokers over 35, we will never give you OCPs. Thrombosis risk: keep patients alive. Keep patients alive. Mini pill? Mini pill, progestin only. Mini pill are also known as POP, progestin only pills. Mini pills, progestin only. Desogestrel blocks ovulation solely. Norethindrone, mucus thick. Breastfeeding mothers, perfect pick. Suppose you are breastfeeding your child and you don't want a pregnancy. So it's a perfect pick. Breastfeeding mothers, perfect pick. Perfect for breastfeeding mothers. And take a mini pill. NE stands for norethindrone enanthate. Types of birth control pills. You know the combined pills which contain estrogen plus progesterone. These are the most commonly used. Then progestin only pills, about which I told you, suitable for breastfeeding or estrogen sensitive individuals. Effectiveness: with perfect use, greater than 99% effective. With typical use, you know that typical use, ना if someone forgets लेके भूल जाते हैं तो उस तरह से. Missing pills or incorrect timing reduces the effectiveness. What birth control pills don't do, this you need to remember. They do not protect, don't have multiple sexual partners. I'm strictly against it. I have one wife, one life. That's about it. Do not protect against sexually transmitted infections. Always be faithful to your partner. Must be taken daily. So they do not protect against STIs, sexually transmitted diseases, gonorrhea, syphilis. Effectiveness can be reduced by certain medications. One wife, one life. Just remember this. And you are sorted in life. What is the bonus which you get? Other health benefits. It regulates periods. Reduces acne. Lessens the menstrual cramps. My wife also sometimes has these painful menstrual cramps. So for that also it helps, and manages polycystic ovarian syndrome and endometriosis. She was prescribed overall, but I'll keep that to myself.